So we're live this morning with Lucy Upton, and she is an experienced paediatric dietitian and nutritionist. Many of you may have heard her before. Hi, Lucy.
Hello, I'm on lots of screens. I'm going to like bounce around the screens looking at everybody. I can't believe it's been a year since I kind of did a similar topic already. It's gone so fast. So hello to anyone who hasn't seen me or met me before. My name's Lucy. I'm a paediatric dietitian. I've been doing it nearly 12 years. I think I've only ever worked with children. I came out of university and was like, yeah, no, I'm going to go work with kids. And so I split my time between lots of things, but I work for the NHS, where I do a lot of allergy work and allergy clinics, but also see children at a big children's hospital where, you know, we deal with things like tube feeding, a very specialist sort of medical nutrition. And then I'm a feeding therapist, so I work with a fabulous team at the Feeding Trust, where we support children with kind of a big team who have more complex feeding difficulties. And I have my own private clinic and lots of other things going on. So you are right, I am a busy lady, but always time for you guys, because I love what Weaning Week does. I really, really love it. And I know how much time and effort goes into the planning of it. I mean, I'm going to focus as much as possible just on allergen introduction during weaning. Why do we do it? How do we do it safely? But also what to do if maybe your baby's got allergies already, and how you might approach that, because I know it's an area of huge anxiety for so many families. So which is why I always start with a really, really important and like kind of really positive key point, which is whilst we are seeing increasing rates of allergy and food allergy in children, and that's probably for lots of reasons, all of which we might not fully understand yet. The reality is most children, and most of the parents who might be weaning their children now, most of those children won't have food allergies. And, you know, 96% of those children perhaps won't have any food allergy or intolerances at all. And I think sometimes it's really important to have that at the back of your mind before you even get going, because it's really easy to default to worst case scenario. And often with that comes a bit of the avoidance of doing it or getting really, really, really anxious. And yes, there will be children who are allergic to food, and we'll talk about what kind of risk factors those might be. But for the majority of children, they are not going to be allergic to food. And the whole process of allergen introduction during weaning is because we've done this big 180 on the advice. And actually, I was talking to a colleague this week, and you know, we heard about all of this information about food allergens and how we were going to have to approach it from a public health perspective and change people's views a long time ago. I remember sitting at a conference, it might have been like 9 or 10 years ago, and I remember thinking how for such a long time, and even now I still hear people saying, you know, don't give them nuts till they're 3, you need to avoid it because of this, etc., etc., etc. And actually we know that there's been so much research pumped in, and actually lots of it's been in the UK, which is amazing, which has really shown us the benefit of actually we need to make sure that these are foods that are included as part of a child's diet as soon as they start getting going with weaning, and that we include those. And the way I like to describe it really is that what we're trying to avoid doing is leaving the door open for food allergy. So potentially the longer that we leave it, the more likely it is that a child potentially could react to a food. Whereas actually if we get it in and we get it in early, then actually what we're hoping to do is therefore prevent that. So we always say, you know, give it early, then continue to give it often. And, you know, that often might look like different things for different people. But, you know, if you kind of go with the idea of giving foods weekly, that's a good start. And then for children who are perhaps higher risk of food allergy, we might be thinking of a little bit more prescriptive approach about how much we want to keep in. And I'll talk about that groups probably separately because they need some careful considerations. So I think the other thing, and I always say this as well, is that there's actually quite a lot of the top 9 food allergens are quite a lot of foods, aren't they? It's like quite a lot of things you might have. You look and you're like, ooh, okay, this is a big list. And actually it's a big list of food, but it's also a big list of very good food. You know, it's you know, nuts and fish and shellfish and milk and soy and eggs, and all of these are very nutrient rich foods that will add a lot of diversity to a child's diet too. So for anybody who wants to know what those sort of top 9 allergens are, these are the allergens in the UK that we see most children allergic to. So cow's milk being one, and lots of people will have heard of milk allergy, and actually lots of children who have cow's milk protein allergy would have had that picked up before they get to weaning age. There'll be a small proportion who won't, but most have got it picked up by weaning age. And then you've got egg, peanut, which is the one that everybody worries about, and I'll talk a bit more about that. Then tree nuts, and it's important to distinguish that those are different. Often we use the collective term for nuts, don't we? Just avoid nuts. And actually, peanuts are a legume. They grow underground. Whereas tree nuts, like the name suggests, grow on trees, and there's loads of tree nuts, aren't there? I always think, but your macadamia nuts, pistachios, walnuts, almonds, and all the like many tree nuts. And then so I've got, so what I said, milk, egg, peanuts, tree nuts. So then you've got things like seeds, particularly sesame seeds. So things like tahini that you often find in hummus. Fish, shellfish, soya, and wheat and other grains that contain gluten. So, and in reality, lots of those foods we kind of do want to be part of a child's balanced diet and offer a lot of nutrients. So, they are the top foods that we see. 95% of reactions in the UK in kids, that's what we see them to, with the big ones being things like milk and egg, and then kind of peanuts and nuts after that. So that's what you're thinking about first when you're thinking about allergen introduction, is know which ones they are so that you know when you're looking to get them in. And as I say, lots of children may well have already been introduced to something like cow's milk protein already, particularly if they've been a formula-fed child, because the formula milk is derived from cow's milk protein and it's whole. So lots of babies will have had lots of that in already. Be a little bit different if they're breastfeeding, and I'll make a note to talk briefly about breastfeeding, but not go on too long. So in terms of, but no, hang on, about 3 hours later, you'll have just left.
There'll be an empty space.
There will just be. I'm like, she's gone to get a coffee. So so essentially, as I said, we're getting these foods in early during weaning once you've got going. So once you've got going with weaning, you've got those initial tastes kind of out the way. It might be veggies, it might be a few other things. You probably want to turn some of your attention to thinking about starting to introduce these foods. And it doesn't need to be a race. You have time, you know, it's guidance that we want them in by around, you know, a year of age. So you have got time to introduce these. And I always say, you know, it can suddenly feel very like you're doing therapeutic weaning if you're suddenly having to plan around trying to get all of these things in. You know, remember that at the start of weaning, your baby might only be taking a few tastes of food and really getting to grips with it anyway. So, you know, you have time on your side, particularly if babies are low risk of food allergy. You know, you've got plenty of time through weaning to start thinking about how to introduce them. And the key things really are that we think about introducing allergens one at a time, because otherwise, if we're looking for signs of reaction, we're muddying the water quite a lot. So I always say, you know, if you're going in to give Weetabix for the first time, and you might be having that with fresh cow's milk, because you can introduce cow's milk or sort of fortified alternative from 6 months of age with food, you kind of, it's fine if they've had cow's milk before, it's fine if they've had wheat before and you know they're okay, but do try and avoid sort of multiple in one go, because if children have a reaction, then just like the parents, I wouldn't be able to tell you which one it was, you know. So we would say one at a time, and I would say generally we say that to start small, particularly if you're nervous about it. You know, some people, I know lots of parents who are just like, I'm just going to give it to them and see what happens. Some people will want to be much more cautious and actually being pragmatic about it, starting with a small amount, so quarter or half a teaspoon or something on the first instance, and then building up over the next few days where you can with whatever that allergen is. There are some children, and again I will talk about kind of the higher risk group in a minute, where you might want to leave a little bit longer between doses, and I'll explain why. But otherwise, you know, generally you're looking to kind of get that allergen in, and once it's in, keep it in at least weekly. So if you started with something like egg, and I do often say, because we know there's more allergies to things like egg and to peanuts, and they're often the ones people worry about, and lots of the data that we've got are about those two allergens first, starting with egg and then peanut is a good way of introduction, and then the rest of the 7 allergens can be in whatever order you want to put them in. You might fancy fish one week, you might want to start with Weetabix or something, that's absolutely fine. What you do want to make sure is that your baby is well before you start introducing these foods. And again, that's because, like, it's hard enough with kids anyway, because you start weaning, their poos are changing because they're suddenly digesting lots of things that isn't just milk. They catch every cough and cold going, particularly when they start nursery. I know so many families have said to me now, we're mixing and it's coming back in a wave of like cold after cold after cold. If your baby has eczema or dry skin, it's quite a good idea to get on top of that beforehand. And what I would say, again, I keep referring back to this high risk group, which I will talk about. If your baby has got eczema and it isn't particularly well controlled, it is so important that you get on top of that, one, from an allergy prevention perspective, but two, because it places them at higher risk of allergy. And 3, if we are looking for any skin changes that might be delayed type reactions. If your baby has eczema already, it suddenly becomes a little bit more difficult to kind of pick that apart. So do make sure you're on top of that. And I have got a really wonderful live that I saved with a paediatric dermatologist on my page, which talks all about eczema in children and what you can do and when to go and get more help. So I won't delve too much down that. And the other thing really, I think the thing that everyone's going to be asking and thinking is, how do you know if your child is having a reaction to food? What are we looking out for? And this is the confusing thing for food allergy. So when most people think about food allergy, you think about those really obvious symptoms, don't you? So everyone goes, oh, it's, you know, when there's breathing difficulties or they get a rash, and I often feel like the immediate symptoms are those that are a little bit easier to pick up. Yeah. So immediate symptoms, when the immune system kicks straight into action and is like, no, thank you very much, I do not like this food, often occur within 2 hours. But to be honest, the majority of reactions we see that are immediate are often within 20 minutes to an hour. So, you know, after you've got that past that 2 hour point, it's no longer, we wouldn't consider it anymore to be sort of what we call an IgE mediated reaction. So an immediate reaction with the immune system going off straight away. What we would expect to see is potentially changes across, and this is the same for delayed symptoms, across body systems. So you might see skin changes. So immediate reactions might be quite, you know, a florid rash that comes on quite quickly and spreads. So like hives, which could be like, you know, like wheals. It might be a pinprick rash again that kind of, it spreads, you can see it worsening. It could be a real flare of eczema. So children who have eczema, parents will say to me and show me photos of, you know, it angry suddenly very quickly after eating for no other reason, you know, for no other reason, and there'd been no contact on the skin, for example. You might also see kind of, and this sort of goes towards some of the sort of the breathing respiratory, you might see swelling. So we call it angioedema, and often it can be around the mouth, it could be on the face, it could be the ears. And actually that's a real red flag symptom if you start to get swelling around the face and the tongue and things like that. In terms of sort of gut symptoms, for immediate symptoms, we would see quite, you know, what we call protracted, quite violent vomiting. Often that might be a little bit later, so it might be like 30 minutes rather than within a minute or so, or diarrhea. And again, what we often see is that those symptoms are alongside skin symptoms, not always, but a lot of the time. And then obviously we have our kind of symptoms where we really start to get a little bit worried about children. It's really important, if you see any red flag symptoms, that you get immediate help, and that might be changes to your child's breathing, you know, wheezing, a hoarse voice or cry. You might see swelling of their tongue, of their lips, and then, you know, around their mouth, and obviously all of these things would compromise their airway. They might get very pale, they might get floppy, and they might collapse. That's, you know, that's 999. But what I will say about that, and it's really, I think, again, a lot of parents need to hear this, the risk of that sort of reaction the first few times you're introducing food whilst babies are young is so rare. I work with lots of families who are also very high risk of food allergy, and I couldn't tell you the last time I heard about that happening to a child when we introduce early. And I think that's kind of reiterating the point is, yes, children might have reactions that we see and we pick up on something, and they're often mild to moderate symptoms to begin with. The chance of a very severe reaction that would need you sort of blue lighted to hospital is in a very slim, tiny number of children. You know, and people are defaulting to worst case scenario when they think about introducing these allergens, and that's what they're worried about. But it's so rare. So, you know, and essentially, you know, I always say to people, the reason we're getting them in is to stop that ever happening, really. We want it from a prevention point of view. Get them in, keep them in. You don't really have to think about it anymore. In terms of delayed symptoms, these are the tricky ones, aren't they? These are the ones where, because they correspond and cross over a lot with things we see in babies anyway. So delayed type symptoms tend to occur anywhere from 2 to 72 hours, so 3 days later. That's tough when you're introducing lots of new foods and lots of things are going on and lots of things are changing. Again, so skin symptoms, you know, you wouldn't expect necessarily those immediate skin changes, but you might see quite persisting, angry or difficult to get in control of eczema, or eczema that flares and becomes itchy, you know, or redness, and that might not be responding to things we would normally expect eczema to respond to. Lots of the things we see in delayed type are sort of digestive, and just to say, even though they are digestive sort of reactions, it is still an immune reaction. It's not an intolerance. Everybody knows I get really upset about that word when it's not right. It's still the immune system, so it's still an overreaction by the immune system. It's just taking a bit longer to manifest, and it's not in the same pathway as those immediate reactions. And that can include, you know, constipation, soft or constipation, diarrhea, blood or mucus in stools, lots of colicky abdominal pain and bloating, flitting between the two, reflux, vomiting, and lots of those are very normal in children anyway. So I think what you'd be looking for is quite a consistent and persistent change, in your child's presentation, because constipation when you start weaning is very normal because their gut is adapting. And the thing to remember when it comes to sort of allergy is that it's replicable. So every time you give that particular food, the immune system overreacts and you see it replicable. It won't do it one day and not the other. So you're always looking for a replicable reaction. And what I would say is those, if you have worries about sort of delayed type symptoms, it might include even things like lots of food refusal. I see lots of children who are just like, nope, I don't want to go near that food. They might have tried it a few times. No. And there's other sort of things going on. Is a food and symptom diary is so helpful for diagnosis because you kind of need to keep track of what's going on. I have a free one on my website for that reason. I'll plug that, but it's free. So it prompts you through kind of what are they eating, what symptoms are you worried about, which body system, and like things like taking pictures. If you're worried about these things, take pictures of nappies, take pictures of skin. All of that really helps us from a diagnostic point of view. So they're two quite sort of separate. Some children have both, but and they cross over a little bit in terms of immediate symptoms and delayed, but actually that's not perhaps as common. And if you are worried that your baby has had a reaction to certain food during weaning, it's really important that you go and get some support. One, to make sure that you're not excluding anything unnecessarily. Two, to make sure you get a diagnosis so that you know what to do next. And three, really, because otherwise I think the pressure on parents and the picking stuff apart becomes all-consuming and so overwhelming. And I know lots of people really, really struggle, and they often just get told, oh, it's normal, or oh, don't worry, I'll try again. And there's a lot of uncertainty. So
I think you've answered that question nicely, that Rish Patel stuff on Instagram. And I think, the food diary idea is a great idea. And just to reiterate that you can't obviously give advice on specific people here, but go and speak to your GP or get some help if you want to start get some support while you're individually diagnosed.
Absolutely. I'll answer where I can. Yeah, you're spot on. I can't answer any individual questions, but definitely go and get some support and don't do it on your own. So that's, general population, most children won't have food allergies. So low risk would be most babies. And also, I get lots of questions from, I've got a nut allergy. Does that place my baby at high risk of a nut allergy or egg allergy or whatever? So important to know that actually you don't necessarily directly inherit certain food allergies from like parent to child or in the family. That's not really how it works. What we call atopic history does, something we always ask about. So that's atopy is sort of a culmination umbrella term for kind of allergic type disease, essentially. So it includes eczema, asthma, hay fever, and food allergy. And there can be a predisposition, but we don't treat that group of children any differently. We would say introduce allergenic foods from around 6 months of age onwards, alongside other foods. You don't need to necessarily do anything different. We would consider them a similar risk. If the high risk groups and the children that fall into that, you might want to be paying more attention. You might want some specialized support, really, are the children who've got food allergy already. For most that I see, that's probably milk allergy, or children, and this is the biggie, and I'm going to bang on about going to get some support if your child has eczema, is children with moderate to severe eczema and particularly severe eczema. And they're often babies who have had eczema start in the early months of life, so within the first month, 2 months, 3 months. Often it is, it's not kind of small patches. It is something that really can be, across their face, across their head, down their torso, down their arms, maybe their back. These babies with eczema are the babies who need steroid cream often regularly to keep on top of it, to really keep that skin inflammation down. And essentially the reason that they sit at higher risk is because, we know that your body needs to be exposed to an allergen first to prime itself with the overreaction that isn't right. It's the immune system getting it wrong, and when we consume foods directly into our gut, we get lots of messages in our body that say that food is safe, but actually if babies have had contact with food allergens in the air, and they've got, our first barrier is our skin from lots of things, from bugs, bacteria. But actually, if they've got eczema, they've got damaged skin, and they have had exposure to, you know, small proteins and things in the air on our hands and all that sort of thing, we know that basically the allergies start from that. So skin is a reason, damaged skin is a reason that, you know, children sensitize to foods before they've ever eaten them. So when people say to me, I've never given my baby peanut, how can they be allergic? Well, actually, so many of those children are those, you know, those with eczema and those who've had sensitization elsewhere, which is also why we don't like to leave that group too long. We don't want to leave, whilst they're, particularly if they've had poorly skin, long time, essentially for the immune system to continue building an inappropriate response to that food. We want to get it in and tell them, this way in your gut is the safe way, and you can have these foods. So, excuse me, if your baby's got eczema, go and get some help.
Yeah.
We talked a lot about in our life. I'm gonna lose my voice. Too much chatting. Frog in my throat. Because I went for that one run this morning in my 1 degree temperature. Will be. So essentially, it's really important that you get on top of that. And those children, I would urge, go and get some support. Go and ask how you're going to introduce those allergens. In a small group of children, particularly those super high risk, it may be that we recommend starting those allergenic foods like egg and peanuts before 6 months of age, but that needs to be with support, because we are weaning before, you know, we have to consider things like how developmentally ready your baby is, how are we going to get it in safely, how much do we want to get in. So, you know, essentially though, for that higher risk group, the advice is much the same in that, you know, go and get some support, you know, go and work out sort of what your plan of action is going to be. And lots of people might have a dietitian or doctor already that they can talk to, but delaying is not what we would do in that group. In fact, being proactive and going, right, we're going to get it in. And lots of the families I see, we see privately, we make a little plan, we go, right, this is how you want to start weaning, and this is how I'm going to make sure that we get these foods in, and this is what we're looking for, and covering all those things we talked about before. So making sure your baby's well, offering it in the morning so you can monitor them for signs of reaction, making sure that their eczema is well controlled, starting small, you know, all of those things we take into account and make sure that parents feel happy and, you know, and safe. But delaying it, as much as it feels quite intuitive to go, I'm so scared, I just don't want to do it, isn't what we would be doing, you know. And if your baby is allergic to something, you know, we also do want to know about it. We don't want to find out when they grab a sandwich at little Johnny's birthday party at 3 years of age. We kind of want to know about it, because actually if we know about it, how we then manage it, we can be very proactive with too. We can look at active allergy management so that it's not something that persists for your baby or your child. So, you know, that would be a really small group. The other thing I would say is that I think the thing to take into account with all of it is also that all babies' weaning journeys are going to be a little bit different. And you can suddenly feel under a lot of pressure. And I know I've got a really good dietitian friend who's doing this at the moment with her little one. And she does allergy too, and she's desperate to get those allergens in. But actually, you know, the weaning journey has taken a little bit of a slower start. And you're just going to have to go with your baby. They might not take egg the first time that you offer it to them. You know, they might reject the porridge that you picked the peanut in. You know, you haven't failed, you haven't lost your window of opportunity. You can go and offer again, you know. But sometimes I say, if you're getting stuck, make sure that you're offering, you know, that food in something that your baby's had already. And I mean, do that anyway. If you know that they've had sweet potato and they've been fine, add some peanut to their sweet potato, for example. And you know, don't worry if they've rejected it. The other thing, as I go on for ages, the other thing I would say is that if you know that you want to make, you know, people follow different approaches for weaning. You might do spoon-fed, you might do baby-led, you might do a combination. Is particularly in the high-risk group, we kind of want to make sure, Lucy gets a bit twitchy, wanting to make sure that food is actually in, not on the floor, fed to your dog, you know, on the walls, you know, and often using sort of pureed and mashed foods right at the beginning to get them in is a good way of knowing that, you know, skill-wise your baby can swallow those foods often, that it's in, rather than, I don't know, maybe I gave them boiled egg finger and maybe they had a bit, maybe they didn't. So if you feel like you definitely want to make sure, I'm not saying you can't offer some of those as finger foods too, do make sure you offer it in a way that you know your baby's actually consumed it and their body has got a dose of that food, if that makes sense. And then once you've got it in a few times, so if you've built up, so you say you've done quarter a teaspoon of peanut butter, your baby was fine, half a teaspoon the next day, built up then to a teaspoon. once that's in and they've had it a few times and it's been a good enough dose, that's fine. Like, it's in, you can go, yay, tick that off, have a little list and track it, and then just try and include it in there, some of their food, you know, kind of on a weekly basis. For higher risk babies, we might say slightly higher doses. So I always give examples like, if you're a high risk baby and you've got an egg, try and aim for an egg a week. So half an egg dose twice. I'm not expecting them necessarily to chow down on a whole boiled egg, a whole egg, off you go. And you can include it in other things. You could do it baby pancakes, you could do scrambled egg, you could do omelets and frittatas, you know, there's ways of adding it in. And the same peanuts, you know, once you've got it in, I would say for a good, you know, kind of good teaspoon of peanut butter or ground peanuts, you know, 2 to 3 times a week. And just make sure you're offering, particularly with nuts, in a safe way for your baby. So peanut butter, for example, you want kind of 100% peanut butter with no added salts and sugars and things like that. But it's also quite tacky. So you want to make sure it's a smooth version. And if it's still, you know, you'd never give it off a spoon kind of whole. You want to loosen it up a little bit with some warm water or a little bit of warm breast milk, formula milk, or whatever, cow's milk, if they've had it already, just to loosen it up, because actually big sticky peanut butter off a spoon is choking risk, because we need lots of skills to move that. It's like coats, doesn't it? Coats around your mouth. So we'll mix it into something hot where it sort of melts in. Oh, I love peanut butter. Do you really? Yeah. You know, I'll win you round.
Oh, no, seriously, it makes me gag. I can't bear it.
Does it? I'm watching you like, ooh, I don't like it. Ground peanuts, not like peanuts. Bless you.
I need to grow up, but I literally I can't
not the safe food. Not the safe food. So yeah, so just, you know, I think be pragmatic about it. Remember that the reason that we're introducing it proactively during weaning is for allergy prevention, which is a good thing. These foods offer lots of different nutrients for your baby. If your baby's high risk, you know, please go and seek some support. You know, you don't have to do it on your own. You don't, you know, I know it's a really, really, really worrying time. Be really objective as well when you introduce those things. Sometimes I think we can be so on the lookout for something to happen. We find it, and be really objective. You know, Allergy UK has a fabulous weaning booklet all about weaning the allergic baby. Keep a food and symptom diary if you're worried about sort of delayed type reactions and you're not sure and you want to kind of pick those apart a little bit. And the other thing to say, I'll talk briefly because this comes up a lot when it comes to allergies, and I feel like as much as I support diagnosing allergies, I undiagnose allergy quite a lot as well. And particularly in weaning, I get lots of, oh, my child's allergic to tomatoes or aubergine or banana, and that's when we pick it apart. It's because lots of these children have had kind of a rash appear on their face and maybe their hands after eating those foods. And often that actually is what we call a contact irritation, contact dermatitis, contact reaction. And that's where the food has touched baby's skin. And baby's skin's really delicate anyway. It's not like us when we've got old and toughened up. It's super, super sensitive, particularly then those children who've got drier skin and eczema. And actually foods that are acidic, but also foods that are really high in histamine, which is what causes us to be red and itchy. Anybody who else is suffering like me with hay fever at the moment will fully understand. You know, it's been awful. Absolutely awful. Really bad. Those babies often can get like some contact redness where that food has been. And, you know, food gets everywhere. So it might be a little bit down here. If I've had it smeared, I've had my spaghetti bolognese on my face. And here, you know, so it will be where it is. And generally that won't, you know, it shouldn't really bother your baby too much. It goes on its own. It doesn't need any treatment. It doesn't mean your baby's allergic. It just means that, you know, that their skin is irritated by that food. And as I say, it might be acidic, it might be salty, it might be full of lots of histamine. So aubergine is a really common one for that as well. So, and those foods you don't have to avoid. You know, they're not going to be causing any harm to your baby. If you're worried that there are other signs that they might be allergic, like we've talked about, so those allergic symptoms, then, you know, be more cautious and go and seek some appropriate advice or support. But otherwise, a little bit of barrier cream can often be enough just to stop it hitting baby's skin and making them irritated. But it's usually sort of nothing to be worried about. Most babies sort of grow out of those sorts of reactions, and they shouldn't be causing them any harm or, you know, discomfort at all. So big topic. Hopefully I've covered lots.
My sister's kids had contact allergies, and they were strawberries and tomatoes. And
really common, both of those.
Oh my goodness, all over their faces. It was horrible. I felt bad for them, but
it looks worse than it is. I think so many babies are so unbothered by it. They're like, why are you making such a fuss? And you're like, they're like wiping their face down, like rubbing and scrubbing and things like that. It's really, really, really common, and we see it with lots of different foods. So again, be objective about what's in that food. You know, I've had a few people say to me, or I've given my baby hummus or a particular, you know, a pouch or something. And actually, if the stabilizer in that or the thing to keep its colour is lemon juice, then, you know, that can be irritating the skin. You know, there's lots and lots of, I see it all of the time, you know, and it's going back to that. It's much more likely that your child isn't going to be allergic to something. So be quite objective about it. I've just realised I put here, didn't I, breastfeeding. Get lots of questions about breastfeeding, food allergies, things like that. So a few people put this question up on my Q&A actually that I haven't got around to yet, and I'll answer it now. So I get lots of questions about babies who might have been exclusively breastfed and they have been well, and then you introduce something during weaning and they have an allergic reaction. So it might be cow's milk, for example, it might be egg. And lots of breastfeeding mums then say to me, do I need to cut that food out myself then now? And the answer to that is no. If your baby has been tolerating it in your diet whilst you've been breastfeeding and there's been no sort of overt signs that your baby's reacting to those foods, no, you don't, because the proteins that your baby is consuming directly from food are very different to what might be passing through breast milk. And breast milk is a incredibly complex and very biodynamic, which is your big word of the day there. Biodynamic liquid food. It's more than just nutrition, as we know, but also when we're thinking about what's passing from mum's breast milk, you know, mum consumes a food that gets digested by her body, passes into the blood in tiny weeny parts, and then via that route is then involved in sort of getting to breast milk. And actually what we also know is that lots of women there's lots of differences in how much of certain proteins each woman might secrete into her breast milk. So it's very, very difficult. So it's not the same as consuming it directly. So, you know, actually, if you're consuming a food and it's fine, but there are signs that baby's had an allergic reaction to it, obviously go and get some support, because you need to be making sure that you know what to do next. But I see so many breastfeeding mums basically cut loads and loads and loads of things out of their diet once baby started weaning. And just to say, you know, if you're worried whilst you are breastfeeding about food allergy, again, please be very, very clear about going to get some support, because what can be really difficult when you get to weaning is if you think that your baby has reacted to lots of things during breastfeeding and you've taken them out your own diet. I see so many parents who then go to me at weaning, what now? Do I put it in? Or do I put it in my diet first? And that really needs individualised sort of one-to-one support, really.
So definitely go and see your GP or get that extra support, like you say.
Absolutely.
And another question that we've been asked quite a lot this week is around vitamins and supplements. And I know there is some advice from the NHS, but the question we often get is, what supplements can we give that we are allowed to give? And especially around weaning with allergies as well. Is there any specific advice that you would give for that?
Okay, so vitamins, there is NHS guidance on vitamins. You can find it on the NHS website. But the long and the short of it is, if you are breastfeeding, then your baby needs to have some vitamin D every day. So about 8.5 to 10 micrograms, and mum should have it too. And I still hear lots of people say, oh, but I'm having it and I've been told that my baby doesn't need it. In the UK, we see such high rates of vitamin D deficiency. Your baby's not going to be getting lots of sun. Yes, your baby is going to be getting it from breast milk, but you need it too. If you're breastfeeding, your body needs it too. We supplement both. So breastfeeding mums should have 10 micrograms of vitamin D every day, and baby directly should have 8.5 to 10. For babies, it's often a drop or a spray. My sister's breastfeeding at the moment. And it was like the first thing I went round after he was born. I was like, vitamins. We all need vitamins. So you get like little sprays, they're really good for baby. Just get them in, because otherwise you might be like trying to get them on your nipple or whatever. You're not quite sure if they're getting them. And then when breastfed babies, if they're still exclusively breastfed, move to weaning, you kind of want to move them onto a combined vitamin A, C and D drop. Now, the thing to say about that is that's the guidance that we have at the moment based on research that suggests that children might struggle to get enough of those vitamins, particularly even when they start weaning. What I actually see is lots of children consuming lots of vitamin A and C in their diet anyway. And so for those children, you might have advice that you just need to give vitamin D, but blanket sort of supplementation is vitamins A, C and D from 6 months of age for breastfed babies. For formula-fed babies, they do also need that vitamin A, C and D, but they're only really going to need that because they're going to get all the extra vitamins and minerals that are already in the formula. When they're having kind of below 500 mils, which is around 18 ounces ish of milk a day. So before then, you don't need to give them any extra vitamins. And then once it's underneath that volume, you can top them up with yeah, and again, it's drops and sprays and things like that. If you are in receipt of Healthy Start vouchers in the UK, you can get vitamins free for mum and baby. And I've actually got, because I get asked this question all the time, I did a free download which covers why we need them, what the recommendations are, and also what products are out there, because I know, particularly from an allergy perspective, some of them contain soy, some of them contain peanut oil, some people want a vegetarian or vegan option, and I've covered all of that, and it's just on my website. It's free. You can just click and download it and have a read. In terms of if your child's got allergies, do you need any extra vitamins or minerals? Often no, but this is why working with a dietitian is really important, because it's kind of my job is to make sure that that child and that mum still gets everything that they need, despite the fact that we're having to exclude certain foods from their diet. And wherever possible, we'll always want that to come from food, you know, and find a way to keep it balanced. And there is always ways to keep it balanced. So yeah, I hope that helps.
No, that's amazing.
Wonderful.
We did have a question about breastfeeding and allergic reactions, but I think you covered that quite nicely.
Yeah, I can see here, in terms of breastfeeding, mums giving potential reactions. So the thing to say about breastfeeding, it's very, very difficult, because we know that the amount of that allergic protein passing to mum's breast milk can be hugely variable. You know, there'll be lots of people who still say that there won't be enough to you know, induce an allergic reaction in baby, which is a difficult one, especially when you work in this area. And I do tend to see this in some babies, but it is very rare. Again, that's kind of, you know, for example, milk allergy, we might see in maybe 0.5 up to 1% of breastfed babies, but we might see it closer to 5% or higher in formula-fed babies. There's quite a difference. Unfortunately, you know, people ask me a lot about allergy testing. Can I have allergy testing before they're weaning? Can I have allergy testing to work out what's going on? Allergy testing is only ever going to be helpful to look for immediate type allergies, and that's because whether you're having skin prick tests or a blood test, which we don't love doing to children anyway, we'll only do them when we need to do them, what you're looking for are certain proteins called IgE, so immunoglobulin E, which I actually managed to get that out. Big word for essentially a protein of the immune system, an antibody that they are going around and primed ready to react to that certain, you know, food, for example. And what you're doing is we're looking for those. So we're you know, skin prick test, you're putting a little tiny little droplet of, for example, the milk reagent that we use to see if we get that immediate response. So we're looking for like a wheel size, and again, blood tests are looking for those antibodies. Now, if your baby's having delayed type symptoms which don't involve those antibodies at all, it's a different type and path along the immune system, you're fishing for nothing. You won't find them. They're not helpful at all. And actually, I will use this, because I will use every platform that I can to say, please don't buy any of the rubbish on the internet. IgG testing, oh my God, everything, hair, tiny weeny blood samples. If it worked, we would use it, is what I will always say. If it worked, we'd use it. We'd have it readily available for people to use. It'd be much easier than for me going, right, actually delayed type reactions, what we have to do is go, we think this is the allergen that we suspect to be the culprit. We remove it for 4 weeks-ish. Keep an eye on what's going on. Do we see any of those symptoms? And then we have to do that fun but not so fun bit for most people, where we reintroduce and see, do we get that replicable reaction? Do these things that we're worried about come back? Do we see them return? And that's really the same for sort of breastfed babies too, you know, and you want to do that one at a time where you can, and again with some support, because I see lots of people go, I'm going to cut these 5 things out of my diet and baby gets better, and I go, I don't know which one of those it is, because I don't. So you have to be always, probably bodes well to my methodical head, where you go, there's one, you know, one thing after another. Actually, I do have an ebook on my website which covers, is specifically for suspected kind of milk allergy, because it's most common in breastfed babies, which talks through the whole process, how to do the exclusion, what nutrients mum needs to think about replacing in her own diet, and a diary for reintroduction, and then what to do next, and where to go for things like breastfeeding support, and where to go for allergy support, and kind of covers all of that, because I know lots of people get a lot of conflicting information about that topic.
Here's an interesting one for you. And I know you mentioned before you were quite passionate about this. What is the difference between allergy and intolerance?
Off we go. Okay. Anything allergic and any allergy is an overreaction. It involves the immune system. So the body's immune system, whether those are immediate symptoms or delayed, it is immune system involvement. Okay. And yes, it can look like intolerance, but I hear this term used so much. And I think the problem is it gets mixed up a lot with kind of a lot of the wellness sort of side of things and people just cutting things out willy-nilly. And it often means allergy isn't taken seriously enough. For some children and for some families, but intolerance is usually something to do with sort of the digestive system. So for example, lactose intolerance is just because the gut doesn't have enough of the enzyme lactase to appropriately digest lactose, which is the sugar in milk, and so then we have sort of digestive symptoms. But for example, with lactose intolerance, I wouldn't expect any skin involvement. I would expect very notable kind of symptoms, so bloating, really loose watery diarrhea, lots of wind and flatulence. I wouldn't expect to see constipation, eczema, skin changes, and some of those other things. And I think this is why it's so important that you go to somebody who knows exactly what they're talking about, and that really understands this, because the term it's one of my bugbears that children with delayed type food allergy get labelled as milk intolerant, because they're not. They're allergic. They're still allergic. It's just that it's delayed type allergy, not immediate type allergy. So if it involves the immune system, it's an allergy. If it doesn't, and it's largely to do with digestive sort of, and it is often things like lactose intolerance and things like that. It's the gut, and it's sort of it's to do with the digestive system mainly.
Yeah. That was quite a concise answer.
Was it for me? Going off on one usually.
So we have had another question from Heather about introducing sesame and soya allergens before 1 years old. Do you want to give her a quick answer on that one?
Yeah, I'm just having a little read of that. So sesame and soya are allergens, but aren't something I'd normally cook with. Okay, so I'll do soya first. Lots of people actually, might not have things like soya milk, soya yogurt, and things like that. What I would say is there's often soya in things like bread. So you'll find in nearly 60-70% of breads contain soya flour. So you may well have already given it to your baby before you've realised. Soya is also so soya finds its way into lots of different foods. Like sausages and lots of plant-based foods, and there's lots of plant-based alternatives for things at the moment. So or you kind of things like tofu are actually really good nutrient rich, particularly things like calcium set tofu, really nutrient rich food to give the baby. So if they're having soya in something like bread or something regularly, and you're not particularly bothered about introducing some of the other things, that's fine. Everybody's journey is going to be a little bit different. If you want to know that you've got it in, it might be worth having a go with something like soya or soya yogurt or something on a few occasions, and they're fine. But you've got to be pragmatic about it. It's a little bit like the tree nuts. Whenever I say there's like 9 tree nuts, that's quite a lot to do. I always say start with ones that you have at home and your baby's more likely to have. You might not have the pistachios every day, but actually you cook with ground almonds regularly. So put the almonds in, prioritize that. In terms of sesame, often big one for people is hummus. Lots of people do have hummus. Hummus contains tahini. Tahini is sesame paste. So if it could be a little bit high in salt if you're buying it, but if you're offering a small amount, I tend to say just have a go at getting them in, because what it also does is it gives you peace of mind for later on if you know that your baby or child, as they get older, might want those foods or have foods that contain those. But find a way to keep it in that's suitable for you. So as I say, often I find that it's hummus for things like sesame, or tahini that's mixed into things, and for soya it tends to be the soya flour that's in bread, unless you're having soya based milk alternatives and stuff.